Next, we will see the nursing rounds. Nursing rounds are conducted by the nurse manager or the head nurse with the active participation of staff nurses and nursing students in the ward. What is nursing rounds? Nursing rounds are conducted by the nurse manager or head nurse. Nurse manager you can see in government hospital there is nurse manager or head nurse with the active participation of staff nurse and nursing students. Who all are the members of the ward nursing rounds? Nurse manager or head nurse, all the staffs in the ward, and all the nursing students in that ward. Next, we will see the purposes of nursing rounds. The first purpose is to observe the physical and mental condition of the patient and the progress made day to day. Nursing rounds, the first purpose is to observe the physical and mental condition of the patient. Through nursing rounds, the nurse manager or head nurse can observe the physical and mental condition of the patient, whether the patient is improved or not, the treatment is effective or not. Then mental condition, the patient is mentally adjusted to the ward and treatment, and the progress made day to day, what all progress occurred by the treatment given by the nurses. Next one is to observe the work of staff. The head nurse can observe the work of the staff. That can evaluate by, for example, if the head nurse is asked the patient about the staff, they will tell this staff is doing well, that staff is not doing well. So their opinion, the head nurse can know they are doing well or not. The good staff know everything about the patient. The third one is to give report to doctor. During rounds, the doctor will ask the condition of the patient, treatment of the patient. So the head nurse or nurse manager should give report to the doctor about the patient. So before doctor rounds, the nurse should take the nursing rounds to introduce patient and vice versa. Through the nursing rounds, the nurse should introduce the patient to the staff and students, and the patient to the staff and students. Patient to the staff and students, and students and staff the patient. Fifth purpose is to carry out the plan made for the care of patient. What all plan made for the care of the patient? To find out, to carry out the plan made for the care of the patient. Then to evaluate the result of treatment and satisfaction of patient with the care. During nursing rounds, the head nurse asks the patient whether the patient is better or not, is satisfied with this care, happy or not. The head nurse will ask the patient, so she can evaluate the result of treatment and the satisfaction of the patient with the care. To ensure safety measures employed for the patient and personnel. During rounds, the head nurse can ensure the safety measures employed for the patient and personnel. For example, if a bedridden patient or an unconscious patient, we should put the side rails. So the nurse can check whether the side rails put or not. Proper care is, if bedridden patient, changing the position of the patient. All these things the head nurse can ensure. Then orient the nurse in handing over and taking over regarding patient's treatment, care yet to be completed, and condition of the patient. During nursing rounds, orient the nurse in handing over, how to handing over, what all things to be handing over, and what all things taking over about the patient, about the treatment, care done and care to be done, to be completed. All these things to be orient during nursing rounds. Then teach the nursing students and hospital staff regarding specific condition. During nursing rounds, the head nurse or nurse manager teach the students and staff regarding specific condition. Check any preventable condition present in the patient, such as bed sore or foot drop. During rounds, the head nurse can check the condition of the patient, such as bed sore and foot drop. This all will happen due to the improper care of the staffs. So the head nurse can check whether the patient getting bed sore or foot drop. Then check the emergency equipment kept nearby the patient for its safety and working condition. When emergency equipments are kept near the patient, during rounds, head nurse or nurse manager check their safety and working condition of that equipment. Then compare the clinical manifestation of the patient having same disease, so that the student understand in better manner and gain better insight. In ward 3 or patient having same disease but different clinical manifestations. So the students can compare the clinical manifestations of same disease patient, so they improve their better insight. Then prescribe any modification in nursing action. Through ward rounds, if patient condition is not better, the nurse can improve the modification of nursing care. These are the purposes of nursing care. Next, we will see the importance of nursing rounds. What are the importance of nursing rounds? The nursing rounds play a crucial part in reviewing and planning patients' care. Nursing rounds play a crucial part, means important part in planning and reviewing the patient's care. Through the nursing rounds, the nurse can plan the patient care and review the patient care. Second one, promote better understanding of nursing care required. Through nursing rounds, better understanding of nursing care required. If patient is not better, you can understand the more care is required that patient. It is a means of testing students' knowledge and acquaintance with all patients on the floor. By asking questions to the students, the head nurse or nurse manager can understand the students' knowledge and the acquaintance with all patients on the floor. Then their relation with the patients on their floor.